Okay, all right, here we go. So I'm going to share my screen here. Okay, can everyone see my screen? Okay, good. Okay, so as I mentioned, here are our speakers tonight. Myself, Matthew, Michael, Martin, and Julie. And we can get started. Take it away, Matthew.
Well, great. Thank you so much, Marie, and thank you, all my friends at NAMI Westchester. Yeah, always the beginning of these meetings are the best, when we get to interact and see each other, and it does feel like a family reunion. It's great to see so many familiar faces, so many friends, and really, in a way, it's a homecoming. Like we said, it's 5 years we've done this, and really the advocacy voice of NAMI Westchester has just been tremendous through this time. So, you know, up here in Albany, we're so grateful to have such passionate advocates. And, you know, unfortunately, you know, as much as I love coming down to Westchester and having this talk, I equally love having you guys come up to Albany and go through the halls of the Capitol and making your meetings. And, you know, Rob is like a field general going through the floors of the LOB. And so we're certainly going to miss that this year. But what we're doing, of course, as you've probably heard by now, is doing legislative action weeks instead of doing one day where we bring you all to Albany. So the way we're going to do this is going to be a little different than some of the ones we've done before. I'm going to talk about some of the issues, and as I talk about kind of our big issues, I'm going to have Commissioner Orth kind of jump in as well to talk about how these are playing out on the local level. So this will really give you our perspective from the state, as well as how this is impacting you at home in Westchester. So let's jump in, Marie. We can go to the next slide. Okay, so this is really a critical time for many reasons, as everyone knows. Obviously, this is such an unprecedented moment in time, not just for mental health, which we're concerned about, but of course, all of society has been tremendously impacted by, you know, COVID-19, obviously the racial injustice issues, the economic impact of COVID, and social isolation. It's been a very difficult year. And in kind of this really twist of irony, really cruel twist of irony, the events of the past year have increased the need for mental health services. I don't know how many times over. I mean, we at the state level, our helpline are getting calls at levels we've never seen before. I'm sure many of you have seen the CDC report that's been in our e-news that was done during the summer that said, you know, that 40% or more than 40% of the respondents have discussed new negative mental health symptoms during this period of time. A quarter of our young adults have made suicide plans. They have seriously considered suicide. We had, you know, 33% of the people responding saying they've turned to drugs and alcohol to manage their negative mental health during this time. So we know the need for mental health and detox and substance use services has skyrocketed. And like I said, in a cruel twist of irony, not only does COVID increase that need, but it's also seriously compromised mental health providers, counties, community-based providers' ability to deliver services as their fundings are going to get cut. So this is really, you know, I say this every year, your voice is needed more than ever. It's never been more true this year. We really need to bring our voices together in a chorus to say that we cannot move forward. There is no recovery without mental health. We cannot move forward, get past this without addressing the tidal wave of mental health needs that's going to be coming down the pike. So next slide. So why is our advocacy so important? I love, this is one of my favorite songs, What's Going On by Marvin Gaye. And it was interesting, over the summer, I was driving and the song came on and it really hit me, you know, that so much of what Marvin Gaye was talking about back in the 60s, this was, you know, I remember, I think it was right after George Floyd and everything, and I won't be singing it now. But what's important is the line that really struck out to me was talk to me so you can see what's going on. And that's what's so important, is that our leaders need to hear from us. I mean, we're so lucky today, obviously, to be joined by Commissioner Orth. And let me say, I do these type of presentations all over the state, all NAMI affiliates. Commissioner Orth really is the only one who shows up to every one of these. So he's not one of the leaders you need to really convince, but certainly our leaders in Albany need to hear what's going on. And the only way they can hear what's going on is from hearing it from us and hearing our voices. So it's so important that we really present the picture of what's going on right now. So next slide, Marie. So, as we know, I mentioned this, that this is just such a critical time. And one of the ways that we're seeing it is the media's response to our issues, and all sorts of publications. I was recently featured in Forbes magazine. I joke, I wish it was because of my wealth, but be that as it may, I mean, to have Forbes magazine, the Wall Street Journal, more conservative type of papers really take a look at this and show what a big problem this is. This Wall Street Journal piece was on the reduction in hospital beds in the private sector, which I'll talk about in a moment too. But we've been talking about hospital beds for years, and there weren't enough hospital beds to meet the demand. And the media never cared. They care now. They're listening now. And this is why it's so important that we keep telling our stories. Next slide. And again, you can see it, just all the headlines. Again, when you have the New York Post reporting responsibly about mental health, you really know you're in unprecedented times. So you're just seeing it in all sorts of headlines really talking about what's going on, and really demonstrating that our services are in jeopardy, like I said, at a time when they're needed more than ever before. So next slide. Yeah. So really the message, as you can see, the media gets it. We need to get SOS. We need to save our services. Our voices are needed as mental health and substance use services, both in inpatient and community settings, really are in danger. So next slide, we're going to discuss why they're in danger. So I think we're going to go into, so taking action. We've been obviously very active on this, very active with the psych bed issues. Many hospitals all hospitals across the state had to have 30% of their beds available in case of another COVID surge. And unfortunately, a lot of hospitals, especially downstate, have targeted psych beds and detox beds for reduction. And in some cases, entire units have gone offline, and we don't know if they're coming back. So this really, it's very scary. We're working with the New York State Nurses Association to bring attention to this issue. I don't know if you can see the picture on the right there in front of Brooklyn Methodist Hospital. There's Joan Raleigh holding up a NAMI sign, so we've been well represented in that. And we've also been working with behavioral health organizations across the spectrum to really talk about the cuts to services and our concerns and the need to restore funding. So these are organizations that rarely ever speak with a unified voice. In fact, there have been times where we've had greatly differing opinions, but right now we're all speaking as one with that message. We need to save our services, and that's why your voices are really needed in that as well. So next slide, please. So this gets us to our legislative action agenda, which I said really, the bottom line, the message that we need to keep projecting is there is no recovery with mental health without mental health. New York State must address mental health in order for us to move forward. So in the past, we've had a very broad action agenda that's kind of all over the place. We really streamlined it this year into 3 topics with a lot of stuff underneath, but the big 3 are restore funding to behavioral health providers, ensure access to appropriate services and medication, and improve the criminal justice mental illness interface. So next slide. Restore funding. So actually, since I need to update my slide deck, because it's a little old, but the information is still just as important. So as I mentioned before, we were facing serious budget issues. And I'm sure this is not a news alert to anyone, and we hear it all the time, but what's really impacting us is that community mental health providers, nonprofit mental health providers who have contracts with New York State have since July had 20% of their funding withheld. So we know that these are programs that were underfunded to begin with. I mean, we've made that argument the last 4 years I've been here telling you how our programs are underfunded and struggling to survive. So when you take programs that are underfunded to begin with, take away another 20% of their funding, you can imagine the difficulty this is having. And since this slide was put together, the governor came out and gave his state of the state and his executive budget proposal, which was a little different this year, as everything is a little different. The governor basically gave 3 different budget projections. One if we get no support from the federal government, one if I believe we get $6 billion from the government, and $15 billion from the government. Basically, we want the 15. If we have the 15, things go back to normal. Not that going back to normal is the best, but even with the $5 billion, we would still be looking at cuts of 5% to these type of providers and to counties. If we don't get any support, well, that's worst case scenario. Then you're looking at drastic cuts, revenue raisers, and the governor said there's not even enough revenue to raise to make up that shortfall. So, you know, again, we need to be talking to our federal officials too, saying they need to support the states. And of course, this is not just playing out for providers, but for counties too. I mean, we've heard about schools, police, all the funding that's going to get cut. So I'm really looking forward to hearing from Commissioner Orth right now to hear how this is actually playing out in Westchester and close to home for you guys.
Well, thank you and good evening, everyone. It's great to see so many friends. Thanks for joining us. And as Matthew said, I mean, clearly this impacts aid to localities. We were fortunate to have, as commissioners, weekly calls with all the O agencies. And initially the cut, the 15% withhold, was also for housing providers. And again, because of the advocacy, many of our individuals would end up losing their housing. So I think common sense prevailed. So the housing providers were held harmless. And then we had to come up with the 15% withhold for other essential services as well. And as Matthew said so well, during the time there's such great need, it created a lot of stress on the system. I do have to thank all the providers for rallying. We looked at where it had the least impact, but of course it's hard to do because all of the services are so essential. But we're optimistic now with going back to more of a 5% cut. There was an increase in receipts at the federal level. So we think it's going to be a little easier, hopefully, and the 15% withhold are not going to go through, as Matthew said. And obviously, there's a big difference between $15 billion and $6 billion. I'm actually on the governor's OMH advisory council. We had a meeting this morning with the OASIS and OMH commissioners, and we're really looking at all the different scenarios and the impact on the counties. So we're hoping for the best. As Matthew said in the beginning, if there's ever been a time for all of our residents, whether you're experiencing the first time the impact of COVID-19 or you've had mental health or substance use issues for a while, clearly this is the time to be supportive. And regarding this issue, I want to thank also, I see Jan Fisher from Nonprofit Westchester is on this call. And as Matthew said, one of the key goals is sustaining and supporting our essential services. And they include the peer advocates, the case managers, the therapists. And we all know that these are all individuals who aren't making a whole lot of money. They're also impacted by COVID-19. And then you look at the disproportionality impact of communities and staff of color. That was even a greater ripple effect, as they say. So I want to thank Jan for all of her advocacy efforts, as well as the providers. So let's hope for the best. Let's be as strategic as possible. And as Matthew said, let's get up to Albany, or at least be there virtually, to really advocate for these services.
Oh, man. Thank you, Commissioner. So we can go back into the slides and I think we're going to talk about access next. Always one of my favorite subjects. There we go. So our second, and this is the biggest umbrella, a lot of our little sub things that used to be on our action agenda all got rolled into ensuring access into appropriate services and medication. And as I said, we need access more than ever, and we see access dwindling, which is really scary. So a bunch of things. So one of the big things that came out of the governor's state of the state and budget talks is that he wants to expand telehealth services to all New Yorkers. And we know telehealth has been more utilized, certainly during the pandemic. I mean, obviously, video, all these services are being used more, but it has been successful for a lot of New Yorkers. But one of the things that we're very concerned about, there are definitely sections of New York, pockets of New York, more rural counties, even some inner urban areas that don't have the broadband or the fundamental foundation to really have successful telehealth services. So while this is certainly a positive initiative, it's not an end-all be-all, and we certainly support it. But again, we have to remember that this is something that the governor says all New Yorkers. Let's be a little realistic about that and realize that we need to expand our efforts to make sure it really gets to all New Yorkers. Again, obviously adherence to medicine is such a big issue always, but especially now while people are struggling with mental health issues. That's why it's so important that we have both prescriber prevails, meaning the doctor has final say over what medication a patient gets, not the Medicaid program. So that's always a big one in our budget language. We're always a little worried that's going to fall out. We're a little more worried this year as everything becomes a little more vulnerable. With medications too, we need a new bill for this, but right at the end of the last session, Assemblywoman Gunther, our mental health chair, introduced a bill that would prohibit insurance providers from using what we call fail first and step up procedures for specifically for psychiatric medication. So again, what this means, and you've probably seen me before, you've heard me talk about this, if under private insurance, my doctor gives me, prescribes for me medication A, I go to the pharmacy, I see that I'm getting medication B, and because my insurance company won't pay for medication A. And again, I want to clarify, I'm not talking about a generic version of the drug my doctor prescribed for me. I'm talking about a totally different drug. So maybe, again, there's so many drugs that can be used to treat like bipolar disorder, let's say. My doctor looking at my individual set of symptoms, we always talk about person-centered care and making sure we're tailoring the care to the individual. Thinks I deserve, or thinks that my set of symptoms would best be treated with medication A. Unfortunately, medication A is expensive and my insurance company doesn't want to pay for it. So they're making me take medication B and demonstrate failure to help me before they'll allow me to step up to the originally prescribed medication. It's a very dangerous practice, especially when we talk about antipsychotics and antidepressants. So Assemblywoman Gunther's bill would outlaw this practice for psychiatric medication. So that would be a great positive step when it comes to medication as well. We're also been pushing for a bill that would allow pharmacies to administer long-acting injectable medication, which we know has been a lot more successful in helping people adhere to their treatment. Listen, I take medication every day. I take my Concert, I take my vitamins. There are times I forget, and especially if it's been so busy, sometimes I'll forget to take my vitamins or something like that, and I'll be okay. But if someone, skips a couple of antipsychotic pills, it could have a very quick negative effect, both physically and mentally. So that's a very important thing. And services as a whole, a couple of things. We talk about what we want to see for fully integrated and services. So it's a lot of different things. I mean, the commissioner already talked about what happened with housing, which is a positive development, but we also want to make sure that all communities have mental health housing, assertive community treatment teams, also known as ACT teams, mobile intervention teams, respite centers, crisis centers, certified community behavioral centers that integrate care, telehealth, which we spoke about, first episode psychosis programs and coordinated care programs, and really all the programs that integrate psychiatric services and primary care settings and mental health clinics and schools. So we really want a broader range of services to treat the full spectrum of mental health disorders, making sure if you need a little bit or you need intensive care, that those services are there and are readily available. A couple other things that are important. You know, as the need for mental health care increases, we want to make sure that we have a fully operational and fully viable mental health workforce. There's a group of people, licensed mental health counselors, who have very similar training to social workers, but in New York State aren't allowed to diagnose patients, and their services aren't billable by Medicaid. So this is something we're very concerned about. These are talented people, and we're not utilizing their skills, and people need their help. So it seems like a waste that we're not utilizing our licensed mental health counselors. So there's a bill that would address that too, and give them diagnostic privileges and allow their services to be billable, both very important. Two other things I want to talk about real quickly, and they sort of go hand in hand a little bit, is crisis response in Nicole's law. So, you know, since we last spoke, I know a few people here, when we were in Albany for the last legislative mental health day, took place in a press conference with our former mental health chair, Senator Carlucci, who about having a 988 number in New York State, where instead of calling 911, people would have another easy to remember 3-digit number. Well, since that press conference, the FCC on the federal level has approved a 988 number that's got to be put into place by 2022. But more than a number, we want to make sure that we have a fully integrated crisis response system that, you know, doesn't overutilize police when mental health calls are made. That you know, that we have more services, more mental health courts, more places to divert people to. You know, we talk all the time, we need to divert people away from the criminal justice system. Well, what do we do when there's no places to divert them to? So one of the other interesting aspects of the governor's State of the State and budget address is that he announced that OMH, the Office of Mental Health, is partnering now with Johns Hopkins University to come up with a new crisis response model. Now, NAMI National has its own set of recommendations that we've been sharing with legislators, and it's going to be very interesting to see what OMH comes back with. But one of the things that they've talked about is crisis respite centers, or crisis centers, which we think would be a very valuable and needed tool for community mental health. Because as I said, you know, when we work with the police, they've realized in most communities, they have very limited options, really 2 options. Either they can arrest the person and bring them into the station, or they can take them into the emergency room. And you know, I've talked to so many police who have sat there with people for days in emergency rooms, and this is pre-COVID. I mean, I can't even imagine going to an emergency room now. That, you know, so they know both these options aren't what's best for the people. And we need a third option, like crisis respite centers or crisis stabilization centers, where they can take the people, they can get peer support, stabilize them, and then take the next steps. It's been very successful right north of you guys, up in Poughkeepsie in Dutchess County. There's a good model for crisis respite. And then, of course, Nicole's law, which I talked to you about the first time last year, which is, again, the law that NAMI New York State, or the bill that NAMI New York State wrote. I don't think Roy and Lucille are with us today, but our members in Putnam County lost their daughter, Nicole, to suicide a few years ago after really just a horrible bout of time where she, in a 6-month period, was hospitalized 5 times following a suicide attempt. And in each case, the discharge practices were inappropriate and really they failed her. And after the last discharge, she took her life. So this would reform a lot of the hospital practices, especially the discharge practices, making sure that people have fair and significant notice ahead of a discharge. People are connected with services upon discharge. There's a minimal follow-up post-discharge. There was a study by Brown University that demonstrated that just sending up one postcard a week to someone after they were discharged for a suicide has a tremendous impact on their recovery. Just knowing that people still care for them and that people want to see them succeed, and the people that cared for them in the inpatient setting are still concerned about them can have a tremendous impact. So, just yesterday, we actually met with our new Senate Mental Health Chair, Senator Samara Brock from Rochester. She seems like she's going to be a great supporter for us, very passionate about criminal justice issues, and she was very interested in Nicole's law. We're going to be working with her chief of staff and her legislative director to get that reintroduced. We're going to make a couple of tweaks to it. But Commissioner Orth, did you want to talk about anything about the services are available in Westchester, how those have been impacted otherwise, or the other type of services you would
Sure. Just briefly touch on some of the points. You mentioned access to services, and obviously we know it's often driven by insurance and other factors. COVID really exposed that people who had commercial insurance really didn't have as much choice, access. They weren't aware of all the wonderful peer services like NAMI or other services. So it's really brought that to the surface. I know the governor has put money with OMH to look at parity and commercial insurance, and they actually investigate claims from the commercial insurance to see if they're really providing an appropriate level of care. But once we get the person in treatment, it's also effective treatment, right? So looking at more evidence-based practices, looking at effective medication, Dr. Laitman often talks about that, really having peers engaged in service deliveries, and again, use of evidence-based practices. The telehealth is really exciting, and I agree with Matthew, it's been a great tool, but it's not the only tool, and we've seen and heard, as I'm sure you guys have, people struggling. All of our providers are required to continue face-to-face using all the safety protocols. Some people don't have access to technology, or they really medically need face-to-face visits. But as Matthew said, it also includes expanding practitioners. So under the governor's proposal includes peers, unlicensed professionals as well, and also using the various platforms that we're using through this emergency declaration. So I think expanding it beyond just licensed practitioners is critical. The 988 line is really exciting. We've been working closely with OMH, and we're proud. I don't want to be too premature with this, but St. Vincent's has stepped up to the plate through their crisis prevention team, and we're working hard for them to become a certified suicide national hotline site and become the local 988 number. Right now, most of our calls to the national hotline are rerouted to Onondaga County. I love the people there. There's great snow and everything, great weather, but they don't know the local system of care. So we hope to bring that more local. As many of you know, in Westchester, we're one of 3 counties that started a suicide fatality review team process. Sharon is on the committee. Roy and Lucille are on our task force, and they've also advised us on how to approach it. So this is sort of a review after, unfortunately, completed suicide, where we learn from service utilization, sort of gaps in the system, what we can do differently to prevent suicide. And this is based out of a model in Washington County, Oregon, that after 10 years had a significant reduction in suicide. So it's something that we're really committed to. And as Matt said, we do have, fortunately, we do have some new services since we last spoke. We expanded, now we have 6 ACT teams. We had 5 ACT teams last year. We have a new provider providing first episode psychosis. So joining MHA, we also have WJCS providing that. We're up to 55 school-based mental health satellites throughout Westchester County, including sites that have never had it before. Police outreach, we've expanded our police outreach program to include other communities. And one of the things that's exciting, some of our providers got an allocation to do intensive crisis respite. So it's sort of like a step down from hospitalization. We have one that received money for capital funding, St. Vincent's, and for children, the Jewish Child Care Association and Children's Village will now be offering crisis respite. It'll be a licensed program. The one thing that we're challenged with, and we are envious of Dutchess County, is the 23/7, 365 days. And for us, it's really, how do you sustain it? They used what's called disrupt money. Eventually that dries out. So I think we're shooting for that. Thanks to our Deputy Commissioner Joe Glazer and Mark Giuliano, we've created several crisis stabilization teams, but we're not there yet with that full 24/7. But it's definitely something that's in the budget, and Westchester will definitely pursue it. So thank you.
Marie, can you hire me? I think I need to move down to Westchester. You guys are very ahead of the curve. I'm not really saying that facetiously. I mean, like I said, again, we are all struggling right now, and I don't want to minimize that, but you realize, like I said, I do these presentations all over the state, and certainly sit on national calls as well, and you guys really are ahead of the curve. So as much as we always want more, and we should always be asking for more, sometimes it's also good to take stock in what we have and realize that you have a lot more services than a lot of communities do, but doesn't mean you don't need more. So,
well, Matt, I just want to add, it's organizations like NAMI, and hearing from Sharon, hearing from Roy Lucille. I know Stephanie Marcazzano's on the call, hearing from parents who've lived it, regardless of what the financial situation is. It's incumbent upon all of us to make the systems better and to learn from our consumers and family members. So, and we have great providers who really are pushing the bar and raising the bar. But as you said, there are a lot of gaps. We're a very diverse county, and we still have a lot of work to do. But I want to thank our advocates and our family members, because they're the ones that are really kind of setting the path for us.
No, and that is so important as we get to telling our stories and actually Advocacy Day. The fact that, I mean, and I said at the beginning, the advocates in Westchester, whether it's Roy and Lucille using their story to create Nicole's Law, or Stephanie using her painful story to create the Harris Project, and I think of so many things. Nina telling her story in a book and really putting that sort of face to the struggle. It's the heart of what NAMI is, and I say this all the time. The greatest thing I think about NAMI, and this is from my perspective too, as someone who's diagnosed over 40 years, my mom has serious mental illness by borderline personality disorder, that we have used our painful experiences as a gift because we've used them to help others. So all the struggles that we've gone through, and and I don't want to minimize it. I mean, I can't imagine what Julie's gone through and what Roy and Lucille have gone through. And we're going to hear from Marty too in his story. So I don't want to make light of the struggles he went through, but at least if those struggles have been used to help other people, and as the commissioner said, I mean, the proof is in the pudding, in the results, and so to be able to use our stories and our struggles to help other people and try to ensure that other people don't have to go through what we went through, I really think that's the heart of what NAMI is, and our greatest power, and really, to me, a blessing. Of course, Devo, thank you for the great work you do. Oh no, I'm sorry to hear about the dog. So we can go back into the slides right now, because I think we're going to talk next about criminal justice, and that'll be real quick. We really have just two big points to talk about with criminal justice. The first being, as Marie turns to the slide, this is where I get really passionate. So first, really two things. Obviously, so much attention has been paid to criminal justice reform, right? We know what's going on in Black and Brown communities across the state, and obviously across the country, excuse me, in New York State too. Obviously, the story of Mr. Prude in Rochester. It's interesting. There's been so much attention to on what's going on in Black and Brown communities, but what people really haven't talked about, that we know that those communities are extra vulnerable, but how about people within those communities who also have a mental illness, like Mr. Prude, right? his incident was a behavioral health incident that led to the crisis response that failed him and led to the loss of his life. But we've seen this in New York State before. A couple of years ago, just south of Westchester in the Bronx, Dorothy Donner, who had schizophrenia and lost her life to police. Before that, there was Eric Garner in Staten Island. That case got a lot of attention, but the fact that Mr. Gardner's family said he had a mental illness didn't get as much attention. So we know, Black and brown communities have a strike against them. People with mental illness within those communities really have two more strikes against them because it's hard for them to get services, making it more likely that police or first responders are going to be needed, and increasing the probability of a negative outcome. So obviously, where police reform is so important, we really also concentrate on the fact that 60% of those incarcerated have a diagnosable mental illness or substance abuse or developmental disability. And we must do better, like I said before, to divert people away from jails into treatment, and as well as improve the interactions between police and people with mental illness. But it's so much more than police. People say we need to reform the police. We need to reform our entire system so police and first responders can most effectively do their jobs in handling people like us and our loved ones. And again, that means having more mental health courts, more services to divert people to. Very important, but it all does start with crisis intervention teams. And of course, the commissioner mentioned my good friend, Mark Giuliano here again. You guys are ahead of the curve. If anyone attended our education conference this year, that you'll see the officer Giuliano actually received the CIT Hero of CIT award this year from us. So once again, he's doing incredible work. He's really a national leader for some of the programs that he's doing. He's so ahead of the curve. And again, so we know how successful CIT can be in Westchester. Where we're really worried, though, is that funding for CIT is dried up. A couple of things. There was $400,000 in the 2019-20 budget that is still in OMH that hasn't been allocated to what's called the Institute for Police Mental Health and Community Collaboration. If anyone's seen Don Kamen speak, he's the head of that institute, and they're the ones who coordinate the entire CIT program for the state through the sequential intercept mapping and all the other pieces that need to be in place for a successful CIT. So 2 years ago, they still had half of their funding that hasn't been delivered. And in the last year's budget, the one that got passed as the outbreak started, they have no funding. So they got no funding. So they're really running on fumes right now. And it's one of the things we talked to Senator Baruch about is that, the funding for the Institute came through the legislature, specifically the Senate. So we're hopeful that we can get them some more funding. It's so important. The other big initiative, and this is an old bill number, you'll see it says need new. The new bill numbers actually just came out last week, but the HALT bill, humane alternatives to long-term confinement. Really reforming the use of solitary confinement in New York State. Really capping the amount of time someone's subjected to solitary confinement, because right now, someone can serve indefinitely. We hear horror stories of people who've been in there for years. So that's the type of thing we certainly want to avoid. We also want to make sure that people who we know have diagnosable mental illnesses, again, 60% of those incarcerated aren't subjected to solitary confinement, because it just has tremendous negative mental health impacts. It's been deemed a form of torture by the United Nations. And in fact, next Thursday, a week from tomorrow, February 4th, there's going to be a tremendous mental health HALT day. I know Marty's going to be speaking at that too. I'll put the registration link for that in the chat room. It's going to be in our e-news tomorrow too. I know we want everyone to take place in our advocacy week too, but if you have some time next Thursday, we really need the voices for HALT, and you're going to hear why in a minute. But next slide, Marie.
Sure, and I'll just interject, Matt, that everyone who's on this tonight and everyone who registered will be getting an email from me afterward with the link to the recording of this, as well as some other information. And I can include in that the link to register for the Halt Day next week. And I'll also have the link to register to attend our legislative days that are coming up in February. So you'll have.
Oh, you make it so easy.
That's the idea. People are working hard to advocate. Got to make it easy for them.
And Commissioner, did you want to add anything about this? Or I mean, we kind of touched on crisis.
Yeah, no, I appreciate it. And, I think the police reform is critical. One of the things that we as a county never wanted to tie the money into the CIT training. We felt that once we became dependent on the funding, once the money dried out, they wouldn't come. So we actually refused the funding. For the past 15 years, we've been doing 4 CIT trainings a year. And we really bring in some experts, but we've built capacity locally where we use people with lived experience. We have people from our department. I see Adam Black on this call and many others who bring their expertise to the table. So when we were offered money for CIT, we actually refused it. Now, there's an issue of using it for overtime for police departments. What we found is if they can't make it, we'd rather go to them. So it's easier for them to do the training. So the other thing that we talked about, CIT is a phenomenal training, but when we talk about some of the issues that we've been experiencing, the training has to include also implicit bias, maybe the undoing racism training. There's a much deeper component to it that I don't think I know the CIT training doesn't touch on. So I'm hoping that they include that lens as well if we're truly going to have effective interventions. We have over 46 police departments in Westchester County alone. And, I just want to their credit, as soon as COVID hit, they called our department and said, look, we're getting more and more calls. This is totally out of our expertise. Can you help? So we assigned each of our DCMH staff member to a police department. They gave us tablets and we provided services from 8 a.m. to about 9 p.m. So I want to give the police departments credit. They do understand the importance of what we all do. They recognize the importance of mental health and peer support. So I'm confident that we can find a way to really make this work where we bring the best of what they do and what we do. And in Westchester, we do have a new district attorney who I think has a vision, is looking to see how mental health can support the work they do. So I think there's good things to come ahead, but we really have to look at that issue of bias and let's talk about, undoing racism a little bit more in these conversations.
So true. Like I said, it's like the police are the tip of the iceberg of the reforms that are needed. Like the commissioner just demonstrated so well, it is full systems, and it's very exciting to hear about the new DA and the focus they're taking. So that's great. So we can move on. So I mean, we've kind of been talking about crisis systems. I don't want to take too much time on this. It gets a little wonkier, but I will give you the packets that has more information if you want to read about all of this. I don't want to take too much of our time as we have a couple more presentations. I don't want to take away from that. So we can move on, Marie. We'll move on from that one too. I'll give you guys all of that. We don't need to get so here we go. So our legislative advocacy week. So for you guys, the week is the week of February 8th. We just sent out information to all the leaders. My intern is very busy right now trying to make appointments for everyone. We really cover a lot of ground as a lot of legislators in Westchester. So we try to get them all. And a lot of people, I just want to really, really quickly address some of the things that I think we always talk about barriers to care at NAMI. Well, today I'm going to talk about the barriers we put in ourselves that keep us from advocating. So we want to increase access to advocacy, get rid of those barriers. So I think like with a lot of things, a lot of people self-impose their own barriers to advocacy. So I wanted to just talk about a couple of things that help demystify the advocacy experience and help you when you talk to your legislators. So, the first and the biggest one, and we talk about this all the time, with a lot of the times that we talk about it, it's leveling the playing field with doctors, and it's kind of the same thing with legislators. Like, we feel like the relationship isn't equal, right? Especially when we say it with the doctor, we kind of have, when I was talking about person-centered care before, traditionally it's like the doctor is above us. They're the ones with the expertise. And what we really try to teach people, that thing is that you're the expert in your own experience. You know what's going on with your body. So you need to advocate for yourself when you talk to your doctor. But with legislators, we have that same thing. We think they're above us. What we tend to forget is the legislators work for us. We're the boss. They're accountable to us. We hire them, we fire them. So you shouldn't be intimidated by your legislator. They really should be intimidated by you because you're the one that is going to keep them in office. So don't let that become an obstacle. Remember that the legislators work for us. This is a really important one. You guys are advocates. I'm a lobbyist. There is a difference. So I talked about expertise before. I'm the one who's an expert on the facts and figures and all the policy wonky stuff that I don't want you guys to get too worried about, because again, you guys are experts in your own experience. No one expects you to know all the little details, the budget details, the legal details, the legislative wonkiness, the policy details. You're there to talk about your own experiences, like the commissioner said before. Stephanie sharing her experience, the Atares, Marty, Nina, Julie. You just tell your story, and if you show how your story ties into the advocacy work, that's the most effective thing that you can do. Or did you want me to stop then, Marie, and have him bring him on?
Sure, I can do that now. Hi.
Yeah.
I'd just like to welcome our Westchester County Deputy County Executive, Ken Jenkins, who's able to join us tonight.
Glad to be here with you, and certainly I'm hearing both from Matthew Shapiro and certainly Commissioner Orth. And I wanted to make sure to stop by. We are Zoom jumping, which is a positive and a negative, which lets us go to many more places than we might normally be able to go to. But it also means that we are going to too many places at the same time. I'm sure Commissioner Orth, and I apologize for not hearing him. So if I'm repeating something that he said, you'll kick me under the table. I can't do that. All right. But the truth is that Westchester County has had a focus on mental health issues right throughout this pandemic and continuing now. I know that we have the new public service announcement that's going yesterday. Tony Aiello for Channel 2 had a great story to talk about the kind of work that we're doing, because we know there cannot be enough advocacy for the things that are happening as far as mental health is concerned. So that's why NAMI is so very important. And I wanted to make sure that we stop by on behalf of the County Executive, George Latimer, that let you know that we are focused on this. We're not just walking we're walking the talk. We're putting money behind what we're talking about. We're making sure to deal with a lot of different issues as far as our challenges in the mental health space right now. And as Matthew said, yes, we do work for you, and we want to continue to hear from you to make sure that we're responding as best as possible. And I got to tell you, right from the very beginning, Commissioner Orth has been there, for all of us, for every area of support. I know I called him on a weekend early on in the pandemic where we had our health professionals basically killing themselves, right? Because they were so used to jumping into the game and trying to resolve an issue. And with the pandemic, no one knew what to do. There was no playbook for this particular thing. And they were working a ridiculous amount of hours. We had to take the commissioner and basically send her home, right? The county executive, who does not use his driver, had his security detail driving around the commissioner, and Commissioner Orth put together a tremendous amount of support for those folks in our health department, relaxation rooms, the ability to utilize the services that the county provides for them, and giving them a chance to think and talk. So it's critically important. Thank you so much, Marie, for allowing me to say a few words tonight. But we want you to know that we know how critically important that NAMI is in this particular fight, and that's why we're continuing. Thank you so much.
Oh, thank you, Deputy Executive Jenkins. It was so a real pleasure to have you. You missed all the kind things I had to say about Westchester County and how appreciative we are. And you guys really are a model for what good community mental health is. And you know, so many different ways you guys are ahead of the curve and how much we appreciate it. So thank you for all you do, and certainly thank you for joining us tonight, sir.
Well, thank you so much, but I want to give the credit where the credit is due. You know, the county executive, George Latimer, and my job, Joe McDonald's job, is to get out the way of the pros. And Michael Orth, Commissioner Orth, is a pro, and what we do is support them. So again, give the credit where it's due. Michael Orth and his team do a fantastic job each and every day. So thanks a lot, man.
You all do. You put your money where your mouth is, and we appreciate it. Thank you. Thanks for being here with us tonight.
All right, so it's hard to jump back in after it's like feel so elated, but just a couple more tips on how to have successful meetings and to demystify the meeting experience. So I was saying, you know, no one expects you guys to be experts. You're only experts in your own lived experience. So don't feel like you need to go in there knowing all the facts and the figures. We'll give you the basic talking points, the basic figures. And it's all right to look at the paper when you say it. No one expects you to be an expert on everything except your own experience. Going along with that, don't feel like you need to answer every question. It's perfectly okay to say, I'm sorry, but I don't know the answer to that. I will check with NAMI New York State and they'll get back to you on that. And we'll also be providing each member a personalized packet with all our information, and you can also refer them to that. My email is in the packet as well. This is a mistake people do all the time. Don't play party politics. What I mean by that is don't assume because your representative or the person that you're meeting with is a member of a certain party that they don't care about our issues. You know, I really think mental health is one of the few issues that really cuts across party lines. You know, we say 1 in 5 people and 1 in 4 families are going to be impacted by mental health. Well, I mean, do the math with legislators. A quarter of the legislators, or 20% of the legislators, are going to have mental health issues in their family. And we have tremendous advocates on both sides. I mean, just take a look at Nicole's law. In the very short time we had before the pandemic really hit and took everything off track, we were getting bipartisan support in both houses for Nicole's law. I mean, and some of our best advocates are Republicans, and some of our best advocates are Democrats. You know, you know, especially we look at our federal level, we have rock stars on both sides in the New York State contingent. We have, you know, Republican John Katko from Syracuse, who is the co-chair of the bipartisan Congressional Mental Health Caucus. Why does he care so much about mental health? Well, I saw him when he was running for office when I went to a NAMI Syracuse event, and he came in and told the story. He was the United States District Attorney for that district in whatever Syracuse is, and he was saying his goddaughter, his niece, was hospitalized. She got discharged before everyone knew before she was ready. And 2 days later, he found her hanging in a closet. He was the one who had to cut her down. And he said, you know, here I was this powerful, you know, federal attorney, and all these strings I could pull, but I couldn't pull enough strings to save my goddaughter's life, to save my niece's life. And if I couldn't do it, he said, I can't imagine what families like you must go through. And he goes, I promise, if I'm elected, I'm going to make mental health a priority. And, you know, politicians will often say a lot of things to get elected and don't follow up. God bless Congressman Katko has followed that up and has been a true champion. And, you know, earlier too, we were talking about with the telehealth and making sure it's in all communities. You know, part of his district is rural, and he's really been ahead of the fight to make sure that people do have access. And then we have people like Paul Tonko, who's been, you know, Congressman Tonko, who's actually my congressman, who really led the way for mental health parity, Timothy's law. So again, my point is we have allies on both sides. You know, we're in such a partisan time right now where we all kind of wear our party's hats and look at the other side as the enemy, no matter what party you're with. But when we're advocating, don't play party politics. Don't think this is going to be a non-successful meeting just because you're meeting with someone from a particular party. Not everyone in the meeting needs to speak or tell their story. Telling our stories are difficult. We know that. So, just being there and showing support and letting your legislators see their constituents who are taking the time out of their schedule just to be with them and be a face to this issue is so important. And a lot of times too, people feel embarrassed and they don't want to participate because they don't know who their legislators are, or they get confused. It's funny, and I hope no one here did. It's perfectly okay if you did, but every year, when people register and we ask, who's your assembly member and who's your senator? Exactly, Marie, perfect. People always say when you ask for the senator, they always put Schumer and Gillibrand. But my point is, we can help you find your state legislators and make the appointments for you. So don't let that be a barrier to care. So we talked about how to tell your story and tie it into legislation. I'm gonna give Marie the link, so when she shares it to you, to the NAMI Smarts module on how to effectively tell your story. There's a handout. It has a work, an activity that you can do. I think I did the exercise with you guys last year, but much more effective than hearing me tell you how to do it is actually hearing variations of the story. So, I know Marie introduced Marty and Julie as NAMI Westchester board members, but we're also so lucky on the state level to have them as state board members as well, where they've just done a tremendous job. Marty's really been the one to lead our efforts with HALT and criminal justice, and Julie is the head of our reintegration committee, and we're working on creating a database of resources and programs that's going to help our advocacy. So they're two of our really rock stars, and like I said before, they're here because of their story to help others. So I turn it over to you. Do you want to go first, Marty? Tell your story and show how you tie it to the issue.
Yeah, sure. Thank you, Matt, and thank you everybody for being here. This is great to see so many advocates. So my story is it really a NAMI success story. A couple of years ago, I had a manic episode, and when the police came for a wellness check, they took me to jail instead of to a hospital for a psych evaluation. So I spent time incarcerated. I also spent time in solitary confinement. Not only was I being tortured, but my mother was too. The families are impacted so much by what happens to, to their children. But luckily my mother found NAMI, and she found our wonderful Sharon McCarthy, who, got her involved into the family to family and provided my mom with the advocacy skills and the knowledge to really support me. And then when I was released, Sharon, my mom said, you have to go volunteer with Sharon. I said, no problem. And so NAMI's become, my second family. Sharon then introduced me to Louise Ellis, who is our president of the NAMI Westchester board. And so it's a difficult story, but I think, as Matt said, it's an important story. And it shows how successful NAMI is, and it shows our legislators, you need to give us more money, you need to pay more attention to us. And as Matt said, also something very important to me is the HALT solitary confinement, to stop this putting anyone really in solitary confinement, but certainly people with mental health issues. And thank you, Matt, for mentioning, I know HALT is doing a mental health day next week. And they're giving us, NAMI, an opportunity to, talk about the important work we do. So thank you all for everything you do.
Thanks, Marty. Your story is so powerful. I've heard you tell your story about your experience with solitary confinement.
Movie. Okay.
Right. Am I muted?
No, I'm okay. Go ahead. Sorry.
I've heard you tell your story, and anyone who would hear that story, it would definitely draw on their heartstrings. And I know that legislators need to hear that story. So thanks for sharing it. We're also going to hear from Julie Claire Nesha.
Yeah, I can't get myself off of to the video to start. Can you do it? I keep hitting start video and it won't let me start it.
No, that
So
would
that
be
people could
weird.
see me. I'm not sure why it won't. So because I keep hitting start video, it won't start. I was on it before, but I don't know why it came off. Unless, should I come out for 1 second and come back in? So let's see if it will let me, so people could see me as I talk.
Down the bottom left of your screen, there should
Yeah, I know, you hit start video,
Right.
but it won't, it's not starting. Unless I come out for 1 second. Should I come out and come back in for 1 second, see if it
Sure.
lets me do it? Okay. All right, I'll do that and see if it lets.
So while she did that, if anyone wants to see it, I just put in the chat box a link to that telling your story document, which I think is so helpful.
Okay, I'll just wait for Julie. So Julie, as Matthew mentioned, is not only a NAMI Westchester board member, but a NAMI New York State board member. And she and Marty are amazing advocates and are so willing to tell their story. I first met Julie a few years ago when we traveled to Albany together to speak to legislators on the Legislative Advocacy Day. So we won't be taking Amtrak
Okay.
in the snow, but I'm happy she's willing to share her story tonight. Julie, are you with us?
I'm with you, but if for whatever reason, it won't let me do it. So I'll put myself as my name. So I guess I'll just, oh, unless, you know what? Wait a second. I know what I can do. I have an idea. 1 second. I'm going to do it on my computer. 1 second. I'll see if it lets me in right away on that. I'm using I'll go on something else because I mean, I could talk.
I can pull up a photo of you.
Okay. Yeah, you could do that. But you know what? I'm just going to try this one other thing and see if it lets me on, because for some reason, I don't know why it's not letting me go in. So wait a second.
Maria, while she's doing that,
We're happy to hear your voice.
I just want to add also, you know, as Matthew said, we have so many good representatives at the state level, but also, you know, reach out to your local board of legislators as well. They often do like coffee conversation with their county executive, and there's so many local issues that they can influence. So, you know, sometimes the best work is done locally. So do reach out to them and be a part of the discussion. They've really been really supportive of mental health. So just didn't want to lose the local level either.
And you know, another thing, another document that we have that I'll make sure Marie shares with you guys is how to get, it gives examples of like letters to the editor and how to get the word out in newspapers, in the news. I can't wait to see the CBS Channel 2 piece, but you know, making sure that these things continue to get into the news. You know, in the beginning of the presentation when I shared the headlines, you know, the media is listening to us now, and we have to strike while the iron is hot. It's so important.
Okay, Julie, I've got a photo of you. So
Okay.
we're looking
All
at
right. So I'll just do that. And then also when my other computer is loading, when it loads, I'll try to get on from a different one. Oh, you know what? It just
We're happy to hear your
loaded.
voice.
It just loaded. If you let me on, do you see me on a different one? It's loading now.
Okay,
So,
I'll keep looking, and when I see you, I'll pull
okay.
you
It
up.
says
But in
connect.
the meantime, what?
All right. So in the meantime, I'll start and you can all look at the picture. Okay. All right. So so for my presentation, so I am Julie LeClaire Netches, and I am, as people said, on the board of NAMI Westchester. I'm also on the board of NAMI New York State. And I wear two hats. So I am both a clinical psychologist, and I also am the mother of a daughter with bipolar disorder. And so the part with, I just want to say, because this is really important, and this is, oh, okay, 1 second. All right, see if you can see me. Oh, you can see me now. So I'm I'm coming off of the other one. Can you all see me now? I'll rename it. It's because it's not my, 1 second. Okay. All right, am I on it now? I'm official
I'm
without,
looking for you. You can continue your story. I'll pin you when I find you.
Okay, all right, because I can see me anyway. Okay,
Yeah.
so anyway, so I wear two hats. I am both, like I said, a psychologist and the mother. And I wanted to bring up what is really important with what Matthew had said, which is that especially during the time of COVID is really critical that that be emphasized because of the increased mental health needs. And in my psychology hat, I have seen a tremendous increase of people who are calling and needing help for depression, anxiety, and COVID has really exacerbated that situation. And now I'm going to talk about it from my hat of a mother. So, and I'm going to talk about my daughter. She unfortunately illustrates many of the legislative issues that we are following and advocating for, but I'll just talk about two of them briefly. And I'll just say that my daughter Alexandra, she passed away at age 25. She was diagnosed with bipolar disorder while she was a freshman at Dartmouth. And she also advocated herself. So she published a paper and she was involved in Active Minds. So I feel like I'm a voice from beyond the grave to continue to advocate for her. And so one of the things she illustrates is the very important thing that Matthew was talking about, which is to fight to continue the funding for the crisis intervention teams. And I'm going to give you an example of how my daughter illustrates that. So when she ended up transferring from Dartmouth to NYU because it was really hard, she got stigmatized. So she ended up becoming a college student in New York. And while she was a college student, she was at a restaurant. And at the restaurant, she became manic while she was there. And they evicted her. And unfortunately, they didn't use a crisis intervention team. So when the police came, they were not educated about how to handle these situations. And so she was evicted by a bouncer and the glass door insert in the door broke. And the glass cost more than $250, which in New York State meant that she could be charged as a felon. So she was charged as a felon, put in handcuffs, and she was brought to the prison unit of Elmhurst Hospital, and she was put with murderers as a college student. She was put with murderers from Rikers Island in that unit. And had there been education and people had known how to respond, they would have just known that she needed psychiatric help and brought her right to a psychiatric unit rather than charging her as a felon. And in the end, she did have a happy ending with that. It did get reduced to a misdemeanor and then her charges were dropped and she did eventually get out of that unit and just get onto a psychiatric unit. But as Matthew said, 60% of the people who are incarcerated have mental illnesses and a lot of them don't get out. And so that's one thing. And then I'm going to give you one other example, which is really important, which has to do with Nicole's law. So with Nicole's law, that, as Matthew was saying, is going to make sure that when people get discharged from the hospital, they get appropriate psychiatric care. And what happened to my daughter is she got discharged from a hospital, again, with a manic episode. And she did get placed into a place to live that wasn't really a particularly psychiatric setting, but she was waiting to begin outpatient treatment. And unfortunately, she waited for many, many, many weeks. And while she was living in that place, she was getting very depressed. She was no longer manic, and they were getting angry at her because she wasn't participating and they didn't realize she was depressed. And so what ended up happening is she ended up having a very severe suicide attempt and she ended up on a ventilator. And so the thing is that if there had been Nicole's law in place, then she could have gotten very good discharge planning. She wouldn't have ended up having to wait weeks and weeks and weeks. And she could have gotten that postcard that Matthew said people get that helps them. And she could have had a much happier ending. But in the end, there were happy things that happened to her, like NYU, even though my daughter died before she graduated, after her death, they posthumously gave her a college degree, which was really nice. And I'm continuing her voice by talking. And those are two of the very important issues, really, to both fund crisis intervention teams and to really advocate for Nicole's law and proper care upon discharge when somebody is at risk for harming themselves. So those are my two examples, and sorry for the technical difficulties, but now you could see me instead of just a picture.
Thanks so much, Julie.
You're welcome.
Julie always does a really good job of connecting the.
Thank you, Julie.
You know, again, I hear stories like yours, Julie, and I've heard your story before, but it still hits, and how difficult it is to continually tell it. But like you said, you know, you feel like you're here representing Alexandra and still advocating for her. And you know, she was so lucky to have you as a mom, and we're lucky to have you as part of our family, and so many families are going to be lucky because you're out there telling your story. So just thank you. I just don't think it's a strong enough word. I don't know what word there is, but just thank you. The best I could do is say thank you. And Marty too, you know, to relive what the hell that you've been through, and you know, I'm sure you can't tell that story without putting yourself back into that mindset. I know it's difficult, and you're doing it to help other people. So I mean, really, beyond hats off to the both of you, and it's so important. And like I said, so oh great, the video is there. That it's very difficult to tell stories like this, and that's why that document that I put in the chat box, Maria will send it around too, is so helpful, because it really teaches you how to write out the story, and you know, it's so easy to get emotional when you just tell it, but I think if you write it out first and come to, you know, terms with it, it makes telling the story a lot easier. And you know, you just saw the best at it, two pros, and you know, it takes time, but you know, we'll get you there. And I mean, that's really all of the presentation that I had. I'm really always happy to take questions. I don't know if the commissioner had anything else he wanted to add.
Yeah, thank you. I just think two important areas that they're focusing on also. One is the governor's proposal to create a new office for addiction and mental health services. So they would combine basically OMH and OASIS. You know, you never know how that's going to turn out, but if you take the best of both worlds and really create a competent sort of system of care that responds to both issues, co-occurring competency is something that is a county. Chris John, Stephanie Marquezano, and Drew Mullane co-chair our co-occurring system of care, and all the agencies are involved with it, including peers, and it's something we strive for in the Mid-Hudson. So if we can get rid of some of the regulatory barriers and licensing issues and really do a single unified system, that would be great. The other thing I just have to point out, and I know Adam Black has been leading a lot of these efforts in terms of the peer voice, is how the Medicaid redesign has gone or hasn't gone well. You know, it's something that DOH has implemented, Department of Health, and there've been lots of challenges, and we hear it from our peers, our individuals. So it's something that we should all be aware of. Please advocate, call Adam, bombard him with phone calls, as I'm sure you already do, or let us know. There are structures that are trying to address these issues for both kids and for adults. So, you know, please, you know, have your voice heard, because these are very important initiatives for our family members getting access to these services.
And you know, I wasn't going to mention the merger yet, but since you did, let me just give you right now what NAMI's perspective on this is. That, as the commissioner said, there's certainly a lot of potential there. You know, we always talk about people end up in silos, and we don't want that, because a lot of times these disorders, as the commissioner said, don't take place in silos, or you know, a lot of things going on at once. So to treat the whole person is very exciting, but of course, like you said, the devil's always in the details. You know, making sure that the mental health side of stuff doesn't lose money in this merger. You know, obviously there could be great savings by combining the administrative functions of two different agencies into one agency. You can cut down on that for some savings, but we do want to make sure that our funding remains the same. So we don't have an official position yet. We're optimistic. We're really hopeful that this could be very beneficial, but we're going to wait to take an official position till we see what this actually looks like.
Can I just speak real briefly to the topic? So Matt, I want to say that I attended the listening sessions and testified, and almost everybody that testified statewide was in support of not just a merger, but a true integration. For me, my concern is that the OASIS side is much more highly represented, and I don't think that there's as much involvement on the OMH side. And it's interesting because, quite frankly, when you look at the DSM-5, substance use disorder fits under the mental health diagnoses. So my hope is that perhaps you can maybe I would work with you just to talk through the issues and the topics that we're so focused on, particularly in Westchester and the Mid-Hudson region, to perhaps guide some of the positions that you could take on this. Because to me, one thing on the who's holding on to what funding stream, there's absolutely not a dollar in prevention on the mental health side. It all comes down on the addiction side. And so there's really very little about mental health, coping mechanisms, self-medication that are really part of what that umbrella covers. So I think that there's space on both sides to really expand the umbrella and not feel territorial in the process. Because I do think that at the end of the day, the mental health side comes out stronger through an integration.
You know, Stephanie, we can take this conversation a little aside too. Not everyone has to hear this part of it, but you know, Julie also serves on our Government Affairs Committee. We do have a meeting coming up Tuesday. You know, if you want to come in and meet with our committee and talk about your concerns, I think that would be most welcome. Would you agree, Julie?
Yes, yes.
So I'll reach out to you tomorrow. We can
Perfect.
try to
Thank
figure
you.
that out. Thank you,
Yep.
Stephanie.
Great, that sounds great. You know, I remember a few years ago at one of our NAMI Walks kickoffs, Joe Glazer was new, and he's the deputy commissioner for the Department of Community Mental Health. For those of you who don't know the name, works closely with Michael Orth, and he mentioned that Westchester is the model in New York State for what we do for mental health. And as demonstrated tonight, there's still a lot of work to be done. So thank you all for being here tonight. I will follow up with an email. I'm planning for it to be tomorrow. The Zoom presentation will take a while to download tonight, and then tomorrow we'll get it up and we'll send it out with a link. So I'll send to you the link for the presentation. Also the link for the, was it a commercial, Michael, that was on CBS? Yeah, it's a commercial with Michael interview that was on CBS last night. We've got a link. It was in the chat, but I'll put it in the email too. And then also the link to sign up to be a part of the legislative days. Our area will be happening on the week of February 8th to the 12th. So I'll give you that link. And I'll also give you some tips for telling your story that, that NAMI has put together. So if anybody has any questions, you can send to me by email, and I can get answers for you and send it back. I know that we've been together for an hour and a half tonight, and that's a long time. And I really appreciate you sharing your passion and your stories and your care, because this is such an important issue. So,
And I'm going to put my email in the chat box too, if anyone has questions for me, so they know where to find me.
I just want to say, because I don't know, I seem to be really bad technologically. I can't answer the chats either. So thank you for everybody who said nice things. And Stephanie, the answer is yes about what you said. So, but I don't know how to respond to any of you. So that's my response. Sorry about that.
thank you again to Julie and to Marty for sharing their stories tonight. And thank you for Michael and Matthew for all you've done to let us know what we need to do. So our work is cut out for us.
Yes, thank you, everybody. Thank you,
everyone.
Marie.
Thank you.
Thank you.
Thank you.
Always great being with you and seeing everybody. Everyone's continuing to be well, continue to advocate, and you know where to find me.
Okay, great.
Thanks so much. All right.
Bye-bye.
Thank you.
Good night.
Good
You don't have
night.
to stay safe home. You're home. So good night.
Safe into the living room or to bed, up the stairs.
Good night, everyone.
Good night. Good night.